This is Philip Morris. He is a 55-year-old male who smokes 1 pack of cigarettes per week. He is also deficient in the protein alpha-1 antitrypsin. He presents with shortness of breath, a barrel chest. He sits forward in a hunched position and is breathing through pursed lips. Philip Morris is being assessed for emphysema. Emphysema is a non-curable respiratory disorder involving the destruction of the tissue in the alveolar walls. This destruction impairs gas exchange, leading to overinflation of the lungs. There are 2 ways a person can develop emphysema. 98% of emphysema cases are caused by environmental factors such as smoking, air pollution, and chemical exposure. The remaining 2% develop due to a deficiency of the protein alpha-1 antitrypsin, which we will focus on in this presentation. In normal physiology, the hepatocytes in the liver produce a lung protective protein called alpha-1 antitrypsin. The alpha-1 antitrypsin is secreted into the blood. Neutrophil elastase is an enzyme produced by white blood cells that breaks down bacteria. The elastase enzyme breaks down the protein elastin found in lung connective tissue when the alpha-1 antitrypsin protein is insufficient. Alpha-1 antitrypsin protects the lungs from this neutrophil elastase damage. In the normal alveoli, gas exchange occurs between the capillaries and epithelial tissues that make up the alveolar walls. In emphysema caused by an alpha-1 antitrypsin deficiency, the neutrophil elastase is uninhibited and will destroy the lung's connective tissue at the alveolar walls. The alpha-1 antitrypsin can become trapped in the liver and cause liver damage. The alpha-1 antitrypsin deficiency can also be caused genetically by improper coding on chromosome 14 or the insufficient synthesis by the hepatocytes in the liver. The neutrophil elastase breaks down the elastin, which allows the macrophages to destroy the epithelial tissue of the alveolar walls. This causes the enlarged airspace, which decreases the surface area for gas exchange to occur. The enlarged airspace contributes to air being trapped in the lungs. Full expiration cannot occur due to the loss of elasticity in the alveoli. The chemical reaction of carbon dioxide and water dissociates to form hydrogen ions and carbonic acid. This occurs in order to transport carbon dioxide through the blood until it is expelled from the lungs during exhalation. A person with emphysema does not have the ability to expire all the air from the lungs, which results in a buildup of carbon dioxide. This increased carbon dioxide level means that more carbon dioxide will be going into and staying in the blood. The increased carbon dioxide levels cause excess hydrogen ions to build up in the blood, which in turn decreases the pH level of the blood to below 7.35 and results in respiratory acidosis. With the air being trapped in the lungs, the diaphragm flattens, which requires the use of accessory muscles to force air out of the lungs. The use of accessory muscles contributes to the expansion of the chest wall, giving the appearance of a barrel chest. The hunched over or tripod position reduces the effort required to breathe by forcing the diaphragm down and forward. The pursed lips slows breathing and keeps the airway open longer, allowing for increased expiration. The symptoms of emphysema include an increased carbon dioxide retention, barrel chest, dyspnea, increased respiration rate, pursed lip breathing, short jerky sentences, the use of accessory muscles to breathe, and having a thin appearance. Risk factors. Gender. Emphysema tends to affect males over the age of 30. Genetics. Genetics play a role in the development of alpha-1 antitrypsin deficiency. Smoking. Smoking exacerbates the symptoms of emphysema by increasing the inflammatory response. The inflammatory response causes the neutrophils to release more elastase, which leads to increased destruction of the alveolar tissue. Philip Morris's lung function tests, blood work, and chest x-rays confirm he has emphysema. Treatment. Although emphysema has no cure, many of the treatments are for symptom management. The recommended treatments are as follows. To stop smoking, the use of bronchodilators will open airways and reverse bronchospasms. Corticosteroids help to reduce inflammation in the airways, and oxygen therapy can be used in advanced cases. It is also recommended that those suffering with emphysema protect their lungs from infection with the pneumococcal vaccine and yearly influenza vaccine. To summarize, homeostasis is disrupted due to the impaired gas exchange in the alveoli. This makes breathing difficult. The normal pH level of the blood is disrupted by the increased levels of CO2, causing respiratory acidosis. Proteins. The two proteins involved in emphysema are alpha-1 antitrypsin, produced by the hepatocytes in the liver, and elastin, which is found in the connective tissues of the lungs. Gas exchange occurs at the level of the cell membrane. The efficiency of gas exchange is impaired by damage sustained to the epithelial tissue that makes up the alveolar walls.